Good afternoon and welcome to this month's staff chat. For those of you who are new to the series, my name is Priscilla Andrews. I'm the clinical manager here at the Cancer Wellness Center. And the staff chat series was created as a way to give the people impacted by cancer in our community a chance to sort of be inside conversations between two professionals that are on a topic of interest to the cancer community. And I am thrilled today to have with me Billy Jerard Coleman, who is the founder and executive director of the North Chicago think tank, to talk about health literacy. So Billy, thank you so much for being here today.
Thank you so much for having me. I'm glad to be here.
Yeah. And just to start out with, could you share a little bit more about the mission of the North Chicago think tank and what sort of activities you guys are involved with?
For sure. The North Chicago think tank is still a baby. We're 3 years old. We were founded in 2020. And our mission is to measurably improve the quality of life for hyper-exploited community members of North Chicago, Illinois. And the way that we do that the way we attempt to do that is by building and growing local power, making space for Black innovation and imagination, and centering Black joy and self-care for the community.
Wow, what a wonderful, it sounds like, I get the sense, grassroots effort to help embolden and strengthen the community that I'm guessing that you're either a part of or from, if I can make that assumption.
Definitely from North Chicago, for sure.
That's awesome. Well, and so, we're here today to talk about health literacy.
Sure.
And in a moment, I'm going to ask you to kind of give me your definition of health literacy. But to begin with, I'm just curious about what drew you to the issue of health literacy and how you see that dovetailing or being a part of the work that you guys do at the think tank.
Of course. So for me, and I'm sorry, I'm just looking at my screen to the left. Sorry if I'm not looking directly in the camera. But for me, it was a kind of a dual experience. First was my lived experience living in North Chicago and seeing sickness and health, seeing it try to be managed in the best way possible. Yeah. And then it was also part of experiencing life in the global South. I've been traveling back and forth to the global South for over 10 years and really just engaging with different cultures, specifically indigenous cultures, and saying, okay, how do indigenous populations, or how does the global majority engage with health and sickness? And I came back home, and during the pandemic, I became a community health worker through the Lake County Health Department. Okay. And that where I saw just like the full spectrum of, okay, this is how public health is trying to be addressed.
Got it. Well, and so I want to talk more about your observations about how health literacy plays a role in health and well-being for people. To begin with, what is the definition of health literacy for people? I feel like it's a term even I feel like I talk about, but I'm like, oh, if you wanted me to define it, I'm like, So I'm curious how you define health literacy.
Yeah, so that's really tough. And I'll say that was one of the reasons why I chose to do this podcast from Nature's Emporium in Waukegan, because Nature's Emporium, which is 1101 West Greenwood, it's an amazing space where health literacy is almost personified or, experienced versus written and read, right? And so when you say health literacy, it already has a connotation of standoffishness, right? Because it sounds academic, right?
It's a very technical sounding term, right?
It's technical, but I will say I am going to speak to the definition that has been listed by the HRSA, the Health Resources and Service Administration, because it's most all-encompassing, right? So the HRSA says that health literacy has 3 parts, and that health literacy is the ability to find, understand, and use information and services to inform health-related decisions and actions for yourself or others, right? And I would say on a personal note, I never clarified those 3 parts, right?
So wait, what was it again? Find?
To find, the ability to find, understand, and use information information and services to inform your health-related decisions and actions for yourself and for others.
Wow. And that just makes me think, and I'm writing that down because I feel like I'm going to come back to that.
Sure.
I mean, it just makes me think of how those three things work in concert. So you have three different aspects that if one of those is lacking or is not being supported or provided for,
Yeah.
that's going to have a negative impact.
And I think it's really important. I put in my notes here, it's important that, when we look at health literacy, we look at these three areas individually to truly understand the amount of culturally competent work that needs to be done in these three areas in order for someone to really be health literate, right? And so even when I think about my personal perspective of health literacy, it was just, can I keep myself healthy, right? And that was just like a very flat perspective. If I get sick, do I know to put Vicks Vapor Rub on? Or if I get a headache, do I know, and then when I started engaging in different cultures, I was like, wow, health literacy is so expansive, right? Because even if you talk about finding, right, there's these networks. If you're tied to a community of healers, then your health literacy is about that relationship. Go find it, right? And I remember in Mexico City one time, and I was having a headache, and my good friend Alicia took my hand, and she was using a pressure point, to alleviate pressure in my head, and I was like, wow, like that's health literacy, right? Health literacy could be, okay, you're taking a pill, and you know how to alleviate pressure from, points in the body. And so when I look back at my personal definition of health literacy, it's all of that, right? And connecting with people who approach it in all those different ways.
Well, and it makes me think of what comes up for me is the notion of how to have where people are finding health care, or like how to have that be informed with what are the culturally relevant pathways to finding healing and healers, right?
Sure.
Like,
Yes.
like I read this article that was talking about, like, God, what country was it in? But they basically was a shortage of mental health care workers. Like there was like in the whole country, let's say there were like 20 psychiatrists, but there was a lot of like almost shamanic healing that was part of the culture of the country, and it was a total untapped resource to help people cope on a community level that may not have fit with kind of a Western view of healing, but was actually really effective because it was culturally relevant care for the people in that country.
100%. And I think even when I look at the definition that they've listed, I also like that they separated the difference between information and services, right? Because finding in a lot of localized experiences with health literacy is that someone wants the information in the form of a consultation, right? And that's, I consider, what you'll have to come by, you'll have to meet Bruce, but I consider Bruce to be a healer, and he's so good at consulting. And so sometimes I'm just like, wow, not only is he providing the information, but it's culturally competent because it's not judgmental, it's not harsh, but it is true. Right? It's like, yeah, you need to change something if you want to have this impact, but I'm also going to guide you in that path from information into accepting the service or accepting the.
Well, and that notion of kind of the medium is the message, right?
Yes.
And that it may not be, how much do you bang your head against a wall and say, well, just go online and read this article, or I gave you the pamphlet.
Right.
And that patient or that community of patients, that's not going to be the most effective way to help them access the information and understand the information. I mean, that's part of what I'm taking away is like, it sounds like that was a much more meaningful exchange.
For sure.
Talking to him versus reading some handout that your doctor could have given you, for instance.
Yes. And I mean, even when I was preparing for this conversation, I started to look up these infographics that were specifically about health literacy skills. And it was saying, what are some things that can happen if you don't have health literacy skills? And it's something as simple as follow medication instructions, right? Someone could be as close as having the medicine in their hand, but
Yeah.
if they have the health literacy skill, they don't know how to follow the medication instructions properly. And we've experienced that even with my mom in the home,
Yeah.
saying like, make sure you're supposed to take these things in a particular way in order for it to really be effective. Or even I saw it was saying that people need good health literacy skills to understand appointment letters or hospital signage, right? Even to participate in health discussions, to understand test results. I know there's so many
Oh,
situations,
God.
right, where someone is
Yeah.
giving their test results to someone and saying, do you understand this? They told me, and there's these numbers and graphs and charts, but what does that actually mean? And I thought it was really important to note that if you don't have health literacy skills, it's really hard for you to communicate health symptoms to health professionals, right? So even if you're
Yeah.
experiencing something, it's a part of literacy to be able to truly and effectively communicate the symptoms.
Well, and thinking about like cancer in particular, and both acute cancers, which are like, I kind of think of it as like it's this sort of time limit experience, versus chronic cancers, which are like people who are being treated over a longer term, and
Mm.
how much information, understanding your lab values. We know that having information that is accurate reduces health-related anxiety, and also allows people to be better decision makers and to partner more effectively with their healthcare team. So if you're not being given the tool, because the information associated with a cancer diagnosis can sometimes be even more complex than just like monitoring general well-being.
Mm.
And if there's like not that support to have health literacy around, you know, just your CBC, for instance, like your just comprehensive metabolic panel. How are
Yes.
you going to understand all these? You know, I think of a diagnosis like multiple myeloma, which disproportionately affects the Black community, for instance, and
Mm.
it's chronic. They're always monitoring their lab values, the patients that I know, but it's totally complex, and why you're monitoring those values and how do you understand that, and then how do you translate that into understanding what the doctor's telling you? How do you understand, if you don't understand that, how do you talk to your doctor? I mean, just, I feel my own frustration for patients that don't have that, and it puts a shackle around their ability to get the care that they need and deserve.
It really does, because even when you think about literacy, right, you take the health piece out of it and you just focus on the act of building literacy. There are all sorts of interventions, right, that you can put into place to build that, right? And I think that's where having shared language, right, even if it's a new language that we have to come up with together in a lingua franca sort of way, I think it's really important, because there has to be a safe space for someone to say, I don't know what you meant, or it says, I'm paper. And a huge part of literacy as we experience it now is tied to power dynamics, right? And like a rush. And I know we'll talk about this a little bit later, but there's almost like a rush. I should already know what this means. It's happening. And so let me rush and hurry, or let me soothe my ego to say, I should know what that means. But true, I feel like really culturally competent literacy is when we make safe spaces for people to say, I don't know. I don't know what that meant. It sounds scary, I think. I don't know what to do with it.
Yeah.
Even know if I want it to be explained to me, but I
Yeah.
know something important there, and we need to name it.
You know, this brings up something that I'm curious about your thoughts, because you're talking about that power dynamic and how it can be this intervening variable to attaining health literacy. And I'm curious what you see as some of the other challenges or variables that negatively impact an individual or a community's general level of health literacy.
I would say one of the main barriers that I've experienced and I try to overcome every day is a finite or almost like a binary approach to what reading is, right? There's someone that can look at a forest and they can read those leaves. They know exactly what trees those are. They know exactly what plants those are. I've engaged with water people who know how to read the ocean and they know exactly what it means. They know how to read the sky, they know how to read the clouds. And I think people enter this idea of health literacy in a very very limited way.
Narrow.
Right? It's so narrow. And it's like, you have to know it this way. And if you know it this way, then you're okay. And the reality is that very few people know that way, right? And so we've experienced that even with the North Chicago think tank. When we first launched, we were perceived and still are sometimes perceived as too academic, right? When you think of sciences and medicine, even if you think of the naming of things, there's a very long name for something, and then we have a short version that we use. Because there are various conversations in various languages almost, or dialects within, scientific language. And I think that's a barrier. That's the biggest one is, people saying that's not my language. I don't speak.
It's too technical. It's too academic. I don't understand. Well, and I think that notion of even when people can arrive at the point of feeling safe, feeling comfortable, having a organization of the question to ask, how is that healthcare provider delivering the information? Are they using technical phrases? Are they speaking at such a high academic level that may make sense for them, but for that patient, it just begets more questions, but they've already asked that question, and the message maybe they're getting is, well, I should be understanding what the doctor's saying, and I don't understand what the doctor's saying, but I've already taken up too much of their time, or I'm not going to understand what they're telling me anyway. I think that experience of understandably shutting down when you've even taken the risk to try to gather the information, and then it's too much information delivered in a way that is not comprehensible.
Yes. And I think, when you go back to that definition of health literacy, it's like, okay, well, I found it and maybe I understand it, but now I don't know how to use it. Right?
Yeah.
I know how that fits in. And I'll give you an example. I'm trying to integrate the act of steeping tea into my life.
Okay.
And it seems very simple, right? I'm going to start steeping tea. Well, tea can come in so many different ways. You can have it already in the bag where you're dipping it in the water. I'm used to, but you can also have loose leaf tea. And so I was like, I'm going to get loose leaf tea, and I'm going to get my tool, and I'm going to start integrating this into my life. And it was so difficult. It was so difficult. I was frustrated with myself. I'm like, why can't you just steep tea? What's wrong with you? You should know how to do this. And then I asked myself, well, how would this be if I had arthritis? How would this be if, there were just barriers related to age or gender or nationality that were preventing me from steeping this tea? And I think that's what happens in this experience of health literacy, is that they could even close as having it right there, but integrating it sustainably is tough.
Well, and it makes me think of the fact that I think I'm sure it's true now. I certainly have a sense that historically it has been true that that patient who gets the information, maybe understands the information, and then goes home and is trying to do what's been recommended, what's been prescribed, but wasn't able to track everything the doctor said, or maybe didn't understand everything, or did understand and then has difficulty with it, and then
Yes.
is like, doesn't know where to turn. So then
Yes.
says, forget it, this is too hard, like, right, like goes to that place like that, and then
Yes.
goes back to the doctor. And how does that patient get labeled? Well, they're non-compliant.
Yes. Yes.
And so they're non-compliant, not, whoa, what happened on our end that we didn't provide enough support or training for this patient for them to be successful. I think it gets, I feel like the tendency has been about what is going on with that person that they couldn't do this.
Yes. And you're seeing a shift in examining the system, right? So if someone is saying, I'm seeing my doctor, and they're saying that this could all be resolved if I would just eat more fruits and vegetables. This could just all be resolved if I just eat more food. And we introduce that word just, right? And then that person is like, well, one, I might be suffering from food apartheid, or I might live in a food desert, or even if food is near me, I might not have transportation. And then I might not even understand the produce section. So the North Chicago think tank is, creating engagements and encounters where community members just have experiences with produce. And they have a say, I never ate that before. I never cooked that before. I don't even do with that. And those are important things to put in as interventions, I would say, because they're not going to they might feel shame, right? To say, I'm not literate with squash. I'm not literate with cassava root. I'm not literate in using dill, fresh dill. And so I already feel bad because I'm suffering from this health issue.
Mm-hmm.
And I have to also say that I don't know how to cook, or I don't have the tools to cook,
Well, and even the bandwidth, talking about that notion of lifestyle changes, there's already limited psychic and physical energy to take on things when you're dealing with the stress of a cancer diagnosis, right? Having to be just inherently judicious about where that effort goes. And then that notion of, if I live by a grocery store and I know how to cook and I'm familiar with a wide variety of fruits and vegetables, and I can get in my car and drive 5 minutes and walk into the grocery store and spend 5 minutes getting a bunch of stuff and leave, that takes one amount of energy. But if I don't have a grocery store near me that's selling fresh fruits and vegetables, and I need to take a bus or I need to arrange for a ride, and then when I get there, I have to sit with the discomfort of, I don't know how to navigate this. I don't even know how to use this. What am I supposed to be doing here?
Mm-hmm.
I think it becomes, to me, really understandable why people would just be like, just go into basically a survival state and just shut down and say, I can't do this.
Yes. And when you think about, I'm going to lean on my personal experience with cancer diagnosis. When you talk about health literacy being tied to the ability to communicate your symptom, right?
Mm-hmm.
I shared with you in a previous conversation about the way cancer has impacted our family, and how there was so much difficulty in just acknowledging the diagnosis openly.
Mm-hmm.
And I think when you talk about health literacy, it also includes communication with each other, right?
Sure.
If the doctor told you, you have this happened, and it's very real, and this is the next steps, and this is the timeline.
Yeah.
There's for some people, right, in psychic energy and ability to go to their family and even admit that and say, and we experienced that in our family where, our family members, made a choice based on their current level of, ability to communicate that out. And it had a very interesting impact on our family. And I think those are some of the contexts and nuances that have to be brought back into the office space, where people can feel safe to say, I heard everything that you said and I understand, and I still don't feel like I can fully process what just happened. And I definitely can't process it enough to articulate it to my loved ones in
Yes.
order to really do this in a way that is equitable, you know?
Yeah. Well, and uh, we know people do not process information in the same way when there's an intensity, right? If they get too much information, it comes too soon, it comes too fast at them. The part of our brain that allows us to process that information is just not in the driver's seat.
Mm.
And I come back to that notion of like, if you've asked the doctor and your expectation is, or the doctor's giving you information, the expectation is that I should know this, but even just like neurobiology tells us, no, you shouldn't know this, but you feel disempowered to come back to the doctor and say, everything you told me last time, I didn't remember, I didn't process any of it.
Yeah.
Then,
Oh, I'm sorry.
no, that's all. I was just making my sweeping hand motion.
I remember how freeing it was when you introduced to me that 3-part phrase of too much, too fast, too soon.
Yeah.
Right? And I thought about it. It really I really like when I talk about health literacy, the North Chicago think tank is hyper focused on demystification and really just demystifying all of these emotions and feelings and language to a place where it's just simply stated or simply communicated. And I thought about what it would feel like if not only in a cancer-centered conversation, but just a health-centered conversation, there was 3 buttons. And someone could say, like, it doesn't have to do anything, but they could just hit that button. And while they're getting this information, they're like, this is too much. Mm-hmm. Or that was too fast. Or someone saying, this is too soon, right? Yeah. And I remember, my father passed away from COVID-19 during the height of the pandemic. And I remember standing behind the glass, and he was there, and his chest was just rising, and and I would have loved that button, right, to just communicate. It's too much. It's too fast. It's too soon, right? But I didn't have that, so I was just standing there, trying to find the words. Also trying to comfort my mother. My sisters are back in the waiting room. A lot, you know what I mean? And I think we sometimes overthink it, right? We look for these solutions that are massive when maybe it's just saying, like, give them the safe space to say that was too much. Yeah. Or this is too soon, and maybe that could lead to a more prescriptive approach to, helping them get the health literacy that they need to move to the next step.
Well, I think that to me, this gets into how our healthcare providers trained and acculturated to how to deliver information to patients and how to engage in patient communication.
Yeah.
And I think that there is a growing understanding, although maybe not universally held, about how much our nervous system comes into play as far as how we process information and respond. And those aren't choices. That's just how our nervous system responds when things are too much, too soon, too fast. And that can look placid when in reality, what it is somebody containing being in fight or flight, being in a paralyzed freeze state. That can be that placid look that might look like, maybe from the outside, you might have looked really calm to a doctor walking by, but what was really going on was either a flurry of activity inside, or I'm not even processing what's going on. I'm here, but I'm not really here. And that's just how our nervous system responds in those situations, right? We can't fight against the biology of that. And so if healthcare providers are not aware of that and picking up on that and taking that to account when they're speaking to patients who may be receiving information
Mm.
maybe engaging in the healthcare system in a way they haven't before.
I
And
was,
there's that power differential that is automatically threatening to the system. How do we integrate that into how information is delivered in a way that is easy to find, easy to understand, and easy to utilize?
I think it's in the simple acts of humanizing each other, right? And I think that there are objectives that need to be accomplished. We all have things that we need to do. But I think within the act of achieving those objectives, there can be an intent and an execution of humanizing, right? And saying, how do I center this person's humanity as I engage in this experience? And I think when you talk about the way we train doctors, the way we educate incoming, right? The notion of science has this aura of coldness, right? It's the facts, it's just data, right?
Yeah.
When really those who do this work are coming from a very warm place, are coming from very human, like I want to help humans. I want, soothe. And I think if we get back to that and also find tools or create tools that help us acknowledge when we've moved away from that, it can be really helpful, right? And so I think, unfortunately, when you talk about staffing and things like that, that can, muddy it up, right? If you're a nurse and you just got so much going on, it's going to be
Sure. Especially
hard.
coming out of COVID-19, right? I mean,
It's
there's
tough.
that aspect as well.
Yes. And I can tell you when I was in the ICU, the nursing staff, actually my mom sent them flowers after, because they were so humanizing. They were so humanizing. They stood off enough to not be invasive, but they would do little things while we were, like, our chairs were sat at my dad at the glass. And they little things to just say, like, you're human. You're experiencing some emotions. Your nervous system is doing something. And that was so valuable. That was so valuable. It was something that I don't think I can even articulate. I can't put that on a comment card that you human. But I realized when my mom said we have to send that nursing staff flowers, I was like, wow, like she really felt like they humanized the experience. And I think that should be a definite part of maybe an onboarding or an educational piece to this work.
Yeah. How to create an environment that supports a sense of safety, connection, a sense, it sounds like feeling seen.
Yes.
In that environment, that in a crisis situation, where I like to say your nervous system was probably on fire. Was there at least a little bit of sprinkle of fire extinguisher on that, from just that kind of humanity of recognizing you guys were going through something?
Yes. And I think, the North Chicago think tank we're very much collaboration focused, right? Because that solutions, truly effective community focused solutions, only come when the community, when we're at the table together and everyone is contributing. And I remember sitting down with the HAP Foundation. I remember sitting down with other organizations and listening to them talk about the importance of talking about mortality early, or having plans, or having had that conversation. And all of those pieces are part of this, right? And you think about someone who might get a diagnosis that is not the diagnosis that they want, and they have never had a conversation about mortality. That just, you know what I mean? And they have made no plans. They have nothing prepared.
Yeah.
They jump in the deep end, right?
Yeah.
That's a very different human experience versus someone who's like, okay, I got a will, maybe I have a DNR, maybe I have everything sorted, and I just need to get my estate in order.
Yeah.
And those are two very different experiences. And, I think that just has to be considered, when we realize that people from different walks of life are going through this similar experience of cancer.
Well, and that the context impacts the experience of the healthcare treatment and the healthcare system, right? If you've got the social capital to have a will, to have estate planning, to have things in place so you don't have to have anxiety about those non-medical concerns, then part of your bandwidth isn't going towards that versus the situation like I'm dealing with, oh my God, I might die, I'm gonna die. I don't have any of this taken care of. And now whatever's left over is gonna go to trying to understand what the doctor's telling me.
Yes.
Can I ask a question? Because I'm conscious of the time. I never have enough of it here. I'm curious, we've kind of been talking about a bit about the system side of how to address health literacy,
Sure.
right? That community. I'm curious, what you find most meaningful from a kind of patient advocacy side of how patients can feel more empowered to increase their level of health literacy, of how to become more more versed or more effective at finding information, understanding information, utilizing it. What are those pathways?
So I think for us, we've been very, I'll say from the North Chicago think tank side, then I'll say for me personally, from the North Chicago think tank side, we've been very happy with attempts to create community advisory boards, or to create some sort of space where community members come in and design the solutions that lead to increased health. I think when you have community members within the space, from an empowered space, they can create tools that you would just never think of, right? So I'll give you, well, I have not experienced existing in this country without citizenship. So I don't know what the solution looks like for someone who's trying to get their health literacy while also trying to get their citizenship. But if someone from that community was part of a community advisory board, they could help create it that could drive, the creative solutions. And I think for me, that's the most important. When you talk about trans health, when you talk about any identity that is not yours, I think it can be faulty to think that we can speak of them or speak for them instead of speaking with them. And I think those solutions, the truly effective solutions, have to be created alongside them. And sometimes it's about not taking up space and saying, let me remove myself and let me empower and give resources to those who can do it. And then let's work together to execute or to, push that solution outward. And so we've been working very closely with Rosalind Franklin University of Medicine and Science, and we've been sitting on different advisory boards, and it's just been really good. They've allowed us to host the Albert Schweitzer Fellowship, and that's really, and they also allow us to come in and almost critique the M3 community programming to make sure that it actually.
What is that? The M3?
The M3, so the year 3. So
okay, third year medical student.
Yeah,
You're getting, see, look at health literacy, dude. Come on, you're using the lingo here. Okay.
See how it happens? See how quick.
Right, but I think that's such a perfect example, right? Like that, like here we are, we're having this conversation. We're focused on the notion of health literacy. And when you're within that system in some way, how just natural it is to fall into using that language.
It is.
And I mean, right, and I want to highlight just something that you said there, because to me it really stood out, which is the notion that there's not one solution here, right? Like I ask a question, I'm like, what can we tell people to do to improve their healthcare literacy? And basically the response I got, which gave me pause of reflection, is you got to talk to each of the different communities and groups and because what's going to work to help in the undocumented community is going to be different. The trans community that might be different than the Black community that might, right? Like we're not going to find like a one size fits all because there's different considerations based on the context of that particular patient.
Yes. And the thing is, we're seeing the progress of that. We work very closely with Live Lake County to help drive initiatives through the Community Health Improvement Plan. And one of the main focuses of the work has been creating a spectrum of engagement for people with lived experience and bring people with lived experience into spaces that don't make them feel tokenized, but put them in a position of co-design and co-leading to say, this is how I would prefer to have this experience. How do we design that? And we're seeing so many positive outcomes, saying this is how the meetings need to be structured. This is how they need to be scheduled. This is how, and I think when you talk about health literacy, one of the big things that we did with the Albert Schweitzer Fellow is we created demystified worksheets about high blood pressure, cholesterol, or even the services that the clinic provides, right? So we were putting out information saying podiatry, 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 podiatry. And we just needed something that said, let us help you with your feet, right? Get your feet right, for a lot of the Black community, we don't say the word diabetes. We say sugar. We say my sugar high, right? And so say diabetes, it automatically infers that you're not from us, you're not of us, right? And there's nothing wrong with creating a suite of communications or a toolkit of communications that help humanize someone and validate their culture, right? We get more, people get more understanding. If you're like, are you suffering? You got your sugar high? Come here. Let me show you how to do this.
It's a signal of safety, right? There's some sense that to me that says like, okay, this person is oriented to my cultural context. They might, even if they're not of the same culture as I am, they know something.
Yeah. Yes.
Yeah.
They've been talking to somebody.
Billy, we could keep talking, but the clock tells me what time I have to close the conversation.
Of course.
And what an invigorating conversation. I just really appreciate having you here and learning more about the work that you guys are doing and also having this conversation about health literacy. So thank you so much.
Sure. And thank you so much for having us. It's such a great opportunity to be part of these conversations and to engage. And, I encourage you guys, if you're ever in Waukegan, please come out to Nature's Emporium. We'd love to have more conversations like this with community members where they can participate and engage.
Great. Thanks, Billy. I appreciate it. And thank you, those of you that are here on Zoom that might be watching on Facebook Live or perhaps watching this on YouTube. I will be back here in November for next month's staff chat. So stay tuned for more details that will be on the Cancer Wellness Center website soon. Thanks for being here. Thanks for being here, Billy. Take care, everybody.
Bye-bye.